Good day. I am Kyla Ayesa Rivera from BSN 2-7. So this is the drug literature of cephalexine. Brief history of cephalexine. So cephalexine is a first-generation cephalosporin antibiotic that was first synthesized in 1967. It was developed by Eli Lilly and Company and approved for medical use in 1969. So cephalexine belongs to the group of beta-lactam group of antibiotics, which inhibit bacterial cell wall synthesis, ultimately leading to bacterial cell death. So initially marketed under the brand name of Cephalexine. Cephalexine became widely prescribed for the treatment of various bacterial infections, including respiratory tract infection, skin infections, urinary tract infections, and bone infections. So, over the years, cephalexine has remained an important antibiotic in clinical practice due to its efficacy, safety profile, and relatively low cost. It is commonly used to treat infection caused by susceptible bacteria, and its availability in both generic and brand formulation has made it accessible to many patients worldwide. Cephalexine continues to be a valuable tool in the medical community's arsenal against bacterial infection, contributing the treatment and management of a wide range of infectious diseases. So, cephalexine po is low cost lang siya and very effective. So, based on my experience po, nakita ko pong ginagamit ito ng mga kakilala ko, like yung family ko po. Nakikita ko po na ginagamit nila itong cephalexine, and mahalaga din po na ito po ay effective and ito po ay low cost. So, table of content. So, dito po natin makikita kung ano po yung mga nakalaman sa ating drug study. So, first po is ang cephalexine's pharmacological properties, indication, contraindication, side effects, interaction, dosage and administration, nursing consideration, intervention, and lastly po is current research and evidence-based practice. So, mag-proceed na tayo sa pharmacological properties of cephalexine. So, ano nga ba ito? So, cephalexine po is antibacterial. Siya po ay beta-lactam antibiotic, first-generation cephalosporin, inhibits bacterial cell wall synthesis, effective against a range of gram-positive and some gram-negative bacteria. It is oral administration, low toxicity, renal excretion, and therapeutic uses of skin and soft tissue infection, respiratory tract infection, urinary tract infection, and marami pa pong iba. Next is indication. So, cephalexine, a first-generation cephalosporin antibiotic, is indicated for the treatment of various bacterial infection caused by susceptible organisms. Some common indication for cephalexine include, first is skin and soft tissue infection. It is effective against bacterial skin infection such as cellulitis, impetigo, furuncles, and infected wounds. Next is respiratory tract infection. So, cephalexine is used to treat infection of the upper respiratory tract, including pharyngitis or sore throat, tonsillitis, sinusitis, and otitis media or middle ear infection. So, next is urinary tract infection or UTI. So, alam ko na aware tayo sa UTI, and cephalexine is commonly prescribed for uncomplicated urinary tract infections caused by susceptible bacteria. Next is bone and joint infection. In some cases, cephalexine may be used to treat bone and joint infection, including osteomyelitis and septic arthritis. Cephalexine is commonly used in the treatment of otitis media, are middle ear infection and dental infection caused by susceptible bacteria. So here's how cephalexin is typically utilized for this condition. So it is important to note that cephalexin should only be used for bacterial infection and is not effective against viral infection such as the common cold or flu. Additionally, the common choice of antibiotic therapy should be guided by the susceptibility of the causative organism and local antibiotic resistant pattern. So always consult a healthcare professionals for appropriate diagnosis and treatment of bacterial infection. Next is contraindication. So cephalexin, like any medication, has contraindication. It's important to consult with the healthcare professionals for personalized advice, but generally, contraindication for cephalexin may include allergy. Individuals with a known allergy to cephalexin or other cephalosporin antibiotic should avoid its use. Next is renal impairment. Cephalexin is primarily excreted by the kidneys. Patient with severe renal impairment may require dosage adjustments or alternative treatments. Gastrointestinal disease. Some gastrointestinal condition may require caution or adjustment in dosage when using cephalexin. Pregnancy and breastfeeding. While cephalexin is generally considered safe during pregnancy and breastfeeding, it's important to discuss its use with healthcare provider to weigh potential risks and benefits. And marami pa pong contraindicated or contraindication dito sa cephalexin. So, mag-proceed na tayo sa side effects ng cephalexin. So, meron tayong common side effects. So, yun nga yung gastrointestinal upset. So, maaari tayo ditong magsuka, mahilo, or magtae. Next is skin rash or itching. Maaari tayong magkaroon ng mga rashes or pangangate. Next is maaari din tayong sumakit yung ulo natin sa pag-inom ng cephalexin. Meron din naman tayong tinatawag na severe side effects or meron tayong mga malala na side effects dito. So first is yung severe skin rashes. So itching, swelling, yan. Next is severe gastrointestinal issues. Persistent diarrhea or abdominal pain. Maaari din yung blood disorder, unusual bleeding, or bruising. Next is liver dysfunction. Yellowing of the skin or eyes or tinatawag nating jaundice. And probably, pwede rin tayong mag-seizure. So, ito yung mga side effects na pwede nating maranasan once na uminom tayo ng cephalexin or hindi tayo hiyang sa cephalexin. Next is interaction. So, drug interaction may change how your medication work or increase your risk for serious side effects. So, this document does not contain all possible drug interaction. Keep a list of all the products you can use, including prescription, non-prescription, and herbal products, and share it with your doctor or pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Kasi sobrang delikado nun kung parang mag-self-medicate tayo or susundin lang natin yung alam natin. So, lagi natin tatandaan na kailangan nating sundin ang doctor's order or mga health professionals order. So, kauna-unahan dito is yung probenecid or it is a medication that used to treat gout. Cephalexin levels in the body can become too high when it's taken with probenecid. Typically, it's recommended to avoid taking this medication at the same time. Together, the combination can raise the risk of experiencing cephalexin side effects such as nausea, vomiting, and diarrhea. So, isa pa is yung metformin. So, it is the one of the most popular medication in the US. So, Sa pagkakaalam ko, hindi lang siya popular sa US and dito din sa Philippines is very popular din yung metformin. It's most commonly used to manage blood sugar levels in people with type 2 diabetes. So, cephalexine can raise the amount of metformin in the body by lowering the amount that's cleared by the kidney. Next is yung loop diuretics or yung furosemide. Increased risk of nephrotoxicity, caution is advised. So, lastly is yung oral contraceptive. It is potentially decreased in contraceptive effectiveness. Alternative methods advised during antibiotic use. Dosage and administration. So, when it comes sa dosage and administration, meron tayong proper dosage sa adult and sa mga bata. So, sa adult po is, yung dose range is 1,000 to 4,000 mg daily and divided doses siya. Usual dose po niya is 250 mg, 6 hourly or 500 mg, 12 hourly. Higher doses for severe infection or less susceptible organism. So, treatment duration niya po is 7 to 14 days based on infection type and severity. So, depende po ito kung gaano ka-severe yung nararamdaman natin, kung anong infection, kung ano man yung sakit na nararamdaman natin. Next is yung dosage or treatment recommendation may vary. So, kailangan natin mag-refer to specific product guidelines. So, ito pong sinasabi ko is based lang po sa aking research and ito po ay para sa pang-adult. So, next po is yung pang-children. So, gaya rin po ng adult, meron po tayong specific dose o dosage po sa children. So, usual dose po is 25 to 50 mg or kg daily in divided doses. So, pag severe infection naman po is 500 to 100 mg kg daily in divided doses. So, treatment duration din po niya is 7 to 14 days. So, greater than 10 days for B. hemolytic streptococcal infection po. So, when it comes naman po sa children younger than 1 year of age, use and dose must be determined by your doctor po. Next po is nursing consideration intervention. So, before administration, follow the 12 rights of drug administration for safe patient care. Next po, i-assess natin yung patient's vital signs before administration. So, sobrang halaga po ng vital signs bago po tayong magbigay ng medication sa patient. Evaluate the patient's allergy history. So, kailangan po natin itanong kung may allergy po ba yung patient sa gamot o kung ano pong merong allergy siya para po maiwasan po natin yung re-react po ng gamot sa ating katawan. Next po is periodically monitor renal, hepatic, and hematologic function. Monitor the electrolyte balance. Be vigilant for signs of anaphylaxis, skin rash, antibiotic-associated diarrhea. So, instruct the patient about the potential side effects and emphasize the importance of reporting them promptly. So, kailangan po natin sabihin sa mga patient natin na kapag nakaranas po sila ng side effects is kailangan po sa ating sabihin or ipaalam po natin agad kasi meron po tayong dapat kailangan gawin para sa side effects na nararanasan ng patient. So, kung meron po tayong nursing intervention sa before administration po, meron din naman po tayong after administration. First is continuously monitor the patient for any immediate adverse reaction. Observe for the onset of therapeutic effects based on the indication for cephalexine. Document the time and dosage of cephalexine administration accurately. So, napakahalaga po ng pagda-document ng oras at ng dosage po ng gamot na i-intake natin. Next po is monitor the vital signs periodically after administration. So, tulad nga po ng sabi ko kanina, sobrang halaga ng vital signs. kada inom po natin ng gamot. Next is assess the patient for any signs of allergic reaction, gastrointestinal disturbances, or other adverse effect. Continue to educate the patient about possible delayed side effects and importance of reporting them. Document and report any observed or reported side effects promptly in the patient's record. So lastly is the evidence-based practice. So the role of cephalexine in the treatment of skin and soft tissue infection. So cephalexine remains an effective and highly useful antibiotic for the treatment of streptococcal and staphylococcal skin infection. So 12 years of experience have not diminished its efficacy, and cure rates of 90% or higher continue to be achieved. Its resistance to degradation by gastric acid and its uniform absorption ensure its bioavailability, and its efficacy in twice-daily dosages enhances medication compliance. The suspension formulation is well accepted by the young children, and side effects have generally been mild and infrequent. So, this is the end of the drug study of cephalexine. So, thank you for listening.